with the leadership of the Leeds City Region, we're developing some infrastructure around Bradford and Leeds to try and bring these things into people's lives at scale, and to address that problem that someone mentioned earlier about business models. You know, how are we going to get innovations and new interventions in the field of digital health especially into the market at scale and at speed? So one of the early comments from, I think, Tom Rees was, the EU makes great play of trying to enlarge and systematically invite serendipity. That's exactly what we want to do in the city region. I'll also say that we're wanting to look at health specifically for reasons of where we're coming from, for reasons of what the city region is good at. And this presents its own challenges when it comes to the type of data that we have to examine. Most of today is focused on open data so far. There's lots of things that are personal and private that need assessing and cataloguing and analysing in this particular field. I think it says in the paperwork that I'm representing Digital Catapult Centre Yorkshire. It's important to note that that particular aspect is one aspect. That's the activity that we're ramping up now within the DHEZ. I'm afraid the title is a bit cheesy, but and there will be bullet points, so you'll have to bear with me. In short, what I'm going to talk about is something about the future of health and care. You know, it isn't all rosy. You know, we all know this. So what are some of the features that are coming through? What are some of the problems that we're going to have to deal with? There'll be a word on the sort of types of technology we can look to develop in order to make this to address these challenges and to capture some of the future possibilities. We'll talk about the region and why, in the sort of the civil service jargon, the smart specialisation possibilities in this area are fantastic for our area. I'll talk about some of the design and how that's going to be helpful for particularly the small companies that come to partner with the DHEZ, and then finish off with a few of the next steps. So probably the biggest sort of single factor affecting our health and social care systems is the fact that we're not dying early enough. And the problem is that as we age, we get ill, and we increasingly live with multiple long-term conditions in our later years. And the statistics show, the analysis shows that with the number of conditions you experience, exponentially your quality of life decreases, and exponentially the cost of your care increases. And the estimate is that the NHS spends around 70% of its budget in coping with long-term conditions. And people will have heard about the NHS funding time bomb. In 5 years' time, there'll be a £30 billion funding gap, whatever that means. Now, there are contributing factors to that big ageing population challenge. The lifestyles that our people and that we ourselves choose or are sort of coerced into don't necessarily promote good health in later life. We see large obesity rates. We still see lots of smoking, etc., etc. And we all know that public finances are under severe strain. The NHS might have a £30 billion funding gap. Local authorities are experiencing extraordinary levels of contraction in the budgets that they're being permitted to spend. And bear in mind that I'm told that the local authorities spend around half of their budget on adult social care. So these are enormous pressures that we have to face. Inequality, again, many sort of proposed reasons for that, but we do see great diversity, at least in Bradford district, across our city region, across the country, tied to elements of where you live, how wealthy your family is, what school you go to, still being borne out in differences in health outcomes. So people are, of course, thinking about this and working out, how best to tackle these emerging challenges. So some of the strategic responses are shown here. NHS, no discussion of the NHS is complete these days without mentioning 5-year forward view. People are talking about patient-centred care. Well, how do you deploy that? How do you enable patients to make choices or informed choices that are safe about their own care? There's elements of rebalancing resources, taking funding out of hospitals and putting it into community care. Increasing integration between health and social care. So Devo Mank is the really the stalking horse for all this, putting the health budget and the social budget under one roof in that region, and we'll see what happens. And finally, and very importantly, when it comes to this discussion, there's this question of how do you adopt new technologies? Not all plain sailing. If you want to get new technologies into the NHS or even into local authority cares, there's a mention made by Jamie of the evidence-based required by public health colleagues, same and more so in getting into the clinical commissioning groups, into hospitals, even just dealing with that diversity of commissioning body. So where do you start? And then how do you demonstrate the satisfaction of that variety of people that your technology is the thing to purchase? Personal data is key. That there is, I think, a growing concern, societal discourse about what are you doing with my data? I don't understand. Why would you, as Target, tell me that my daughter was pregnant? My daughter's 20 months old. It's not like it's happened for a while. And then there's this question of workforce skills. You can invent all the new pathways and all the new widgets that you like, but if your workforce isn't prepared or requires some significant degree of upskilling, it's going to take time for that for the full impact of that technology to have its effect in the new environment. So, of course, there are scores of opportunities in different categories that one can think about when one uses that phrase, digital health. Just named a few of them here. I think the point to make is to come back to is these are just enable things to happen. You need to have a pathway. You need to have a context in which these technologies will be applied if they're going to make any difference, if you're going to build a business case, if someone's going to buy them from you. So, for example, if you talk about the potential impact of social media type thinking on social inclusion, massive risk factor in our aging populations is that people become ever more isolated, have a lower quality of life. They contract dementia, and these connections have been drawn. So you might think of a public health intervention along the lines of a befriending scheme, whereby a volunteer would agree to be at the end of a phone and go around and visit a neighbour if they were at a crisis point of some nature. That's fine during the day, not so great at night. So if you can build up something like that monster mesh that we saw earlier that connects the socially isolated person with their care plan, with the volunteer, you can see how you can create benefits in terms of getting care where it's needed fast. So why look at this? Why do we look at this as something that Leeds City Region should do? I'd contend that we have a strong comparative advantage in our existing organisations, in our existing economic geography, to innovate and grow businesses in this area of digital health. So in Leeds, we have NHS England, we have the Health and Social Care Information Centre. Those are key organisations. We have some of the real pioneering NHS trusts around the patch, like Airedale and Leeds Teaching Hospitals. There are some really good established companies working in this field. There's the big beasts like BT, one of our partners in the Digital Health Enterprise Zone. There are also the health records companies, TPP and EMIS, and a number of medical technology players also. Outstanding universities with, very importantly, a global reach, so able to, if we're able to demonstrate that it works in Leeds and in our diverse environment, yes, there's a business case to promote and push for export markets too. And this thing about local needs and corresponding public commitments, it has to go into the context. So if we look at Bradford with real extremes within the district limits of poverty and wealth, of differences in ethnic diversity, differences in rural, urban environment, compare that with Leeds, compare that with Calderdale. Calderdale, a lot of digital exclusion in this area, people left out of the broadband network. What does this mean? How can we work with public authorities to address those? Well, we've got those challenges, we've got them in large numbers, which makes for interesting academic studies, which makes for resilient solutions. Very importantly, at various scales, we've got reasonable and improving coordination of this sort of activity. Within individual councils, there are 11 council areas in the city region, but also across the city region through the network of chief executives and another fora. So, about a year ago now, we received approval from the Department of Business to establish a digital health enterprise zone as one of 4 university enterprise zones funded nationally. And we went in partnership with BT and the City of Bradford Council on a prospectus that more or less outlined as above, wanting to make a global impact on people's lives through innovation in technology-enabled care. So we're thinking about integration of health and social care, very importantly, putting people first. What are their needs? What are the pathways by which they can be served? And what are the technology needs that then emerge? And what we really want to build is a community of practice, an innovative community that includes companies and universities. It includes, if you like, the procuring bodies in local authorities and the NHS. And you'll see that we have mechanisms also for engaging directly with people. So outlining our goals, positive impact, really build some prestige for the Leeds City Region in this area, showcase the art of the possible, but also create businesses and jobs and academic impact. The problems that I've outlined are not just UK or England or Bradford, they're international, so we can promote these solutions and these interventions internationally. At the same time as we innovate, we want to be developing the workforce of the future. We need to integrate for skills, innovation and skills, and build that regional competency. And finally, of course, we want our activity to wash its face. So the 3 major components that are almost ready. So you'll have to bear with me if you want exciting demonstrations of output. We're not there yet. We're building a health and wellbeing centre on the university campus, which is where patients and practitioners and innovators and academics will come together. A digital exchange for digital businesses and the Digital Catapult Centre Yorkshire programme serving to develop new projects in this area. So let me go into a little bit more detail on these. So starting with the one that's happening first, or is opening soonest. The Digital Exchange, those of you who know Bradford, know Little Germany, may be familiar with the Design Exchange. The Design Exchange is the Bradford Council's contribution to the programme, in essence. It's going to become that. There's a small pun on the fact that we're working with BT, of course, there as well. But it's going to be this physical and a social environment. It's very important to be able to make friends around the projects that you're developing. So it will be that sort of physical and social environment for innovation that you see in business parks and business incubators wherever you go these days. It'll be managed by a spin-out from the university called Des Limited, and there's that focus on getting to market at scale and at speed. So a number of mechanisms. Business support, are you invoicing on time? Are your HR processes up to snuff? That sort of thing. But also, very importantly, working with the group of innovators in Bradford, in Leeds, in the surrounding area that want to get involved and want to provide that sort of mentoring advice to the younger companies. And that'll be with fellow tenants and in wider engagement activities. Small, lean startups need access to resources, not necessarily in the long term, but for short, quick interventions. So there will be sets of those resources accessible to those companies on that kind of sets of terms. So to help you with innovation, to help you evaluate what you're doing with some degree of rigor and independence, and to help you develop your skills in whatever areas that might be, whether that's technical or managerial competence. We'll want you to get involved in collaborative innovation projects of quite large scale. The Digital Catapult especially has large ambitions. Talk about that in a sec. And with BT and with others, what we can see is in sort of economic reality, our potential routes to market via those partnerships with large companies. BT especially, I know, have a mixed reputation, but amongst SMEs especially. So you have to take the rough with the smooth and hope to build the appropriate agreements as per the project requires. Building work's starting in a couple of weeks. It's a renovation project, so that'll be open very early in the new year. The Health and Wellbeing Centre is going to take an academic focus, I would say. It's going to be the university's main building, main sort of set of skin in the game. So on campus we're putting up, again, refurbishing a 3,000 square metre building to create a Health and Wellbeing Centre, which has this focus on the prevention, delay, management of long-term conditions. So what's coming in here is our expertise, especially in the allied health professions and in certain long-term conditions that require long-term care, like dementia, like cancer, like diabetes, also skin conditions, mobility issues. So things that are of importance to people, are important to quality of life, that cost the NHS a lot of money. So we'll be running R&D programs, so we're building in some of our digital skills as well in health information assets and digital diagnostics, bringing forward the time at which you determine you're going to get a disease, so you can intervene earlier. Evaluation and trials unit to provide that independent and rigorous evaluation of interventions, especially of that sort of health app or that service intervention style that isn't typically served by your normal clinical trials unit. New degree courses, a physician's associate, master of public health, building that population in the workforce that is comfortable and are advocates of adopting new technologies in integrating across different approaches. A health promotion unit to look at the public health side of things, an eye clinic, picking up diabetes, picking up issues with blindness, and then a larger scale project which is again getting started early next year and will be finished by the end of the year, where we'll be able to mix academics, students, patients, carers, the health professionals and commercial innovators coming along very soon. Digital Catapult Centre Yorkshire is the node that we run on behalf of the National Digital Catapult. The National Digital Catapult is a research and technology organisation funded by government with a remit to advance the UK's best digital ideas. It's supposed to tackle that sort of idea where there's a lot of risk between some sort of academic bright spark idea and the commercial deployment of a product or an intervention, and it's quite hard to find investment for ideas in that particular space. So they're sort of, if you like, filling a market failure in that respect, and we're hoping to bring our interest in health data, health technologies, personal data to bear through this, what they call vertical in health services. yes, we heard a lot about open data earlier today. Fantastic value to be accrued by putting all these things together, mixing them up, pulling out insights. I mean, yeah, how do you measure these things? But people tell me that more than 90% of all data is proprietary. So if you can do such fantastic things with open data, how much more can you do in terms of unlocking value from proprietary? So all these good things we intend to flow from the projects we run in Digital Catapult Centre. The National Catapult has 4 priorities. There's making creative content accessible. There's linking closed and open data sets. There's looking after the Internet of Things, so they're coordinating some of the recent £40 million government investment in Internet of Things. And the 4th is challenges with personal data, security and trust. So we're tackling that in Bradford and with our partners. The mechanisms we're employing, it's about developing collaborative projects. So we need to build a pipeline of companies that want to work with us, identify problems, possible solutions, ways to make those real, develop proposals and secure finance, whether that's public or whether that's from shared contributions of the different partners, almost certainly some contribution of that, and then deliver new high-grade capabilities. And here are some examples of the 3 themes that we're pursuing at the moment. We've targeted the creation of at least 8 major projects in the next 2.5 years, which all 8 may be under these 3, or we may come up with others. So just to finish off, I'd like to explain where we're going next. And I'm going to show you, frankly, a horrible diagram, which I didn't write, so that's fine. The point I want to make here is that we're thinking about the innovation process quite hard, and trying to represent the fact that it's a community that builds these innovations. It's a community that identifies needs, that identifies problems. It's a community that works together to create potential solutions, and then to create new information and data coming out of those solutions. And it takes a community with the business nous to get these things applied and sold and creating real and wide-scale benefit. So we hope that everyone in this room can see a place for themselves in that sort of community. And if you want to take it further, do talk to us. Where we are right now, Digital Exchange will open in January. And we're in talks, obviously, with potential tenants already. We're working with various health partnership bodies, as I mentioned, this sort of coordinating ecosystem. There's lots of grand strategy that goes on. We want to start delivering very soon. We're going to go foster connections, find challenges, get problem statements from the clinicians, turn them into proposals, get them moving into projects. We are starting the Physicians Associate course in September. We think we've had positive noises from the health training funders about making grants available for a number of places on that. So it's a very positive news indeed. We know about going in the right direction there. Our university is hosting sort of one locality, one instance of the NHS Code for Health initiative, where clinicians are learning what it means to build an app and how they can turn their experience into something that can be displayed or create some sort of benefit in mobile technology terms. We are developing around 24 project ideas now as the Digital Catapult Centre Yorkshire, and we'll be opening the Health and Wellbeing Centre in about 15 months' time. But it all depends on building a strong and an active community. So here's the first call to all of you here, or at least to most of you here. It'll be the first you've heard of this. So look at the website, come and find out some more. Tweet at us, join in. And this is a LinkedIn group, by the way, which has dizzy heights of about 30 at the moment, something like that. But we're building that all the time. We want people to join that community, And there's at least half a dozen events planned between now and Christmas, and it'd be great if you were able to come along to one or more of those. So that's me. Finished. Open for questions.
Thank you. Thank you very much, Liam. Well, thank you very much.